I'm Christy Money with the Caldwell County Health Department, and here with me today is Leslie Wagner, public health nurse in our clinic. Welcome, Leslie. Thank you for being here. So October is Breast Cancer Awareness Month. You see lots of pink ribbons to bring awareness about breast cancer to everybody. I was going to say to women, but not just women, to everybody.
Yes.
So Leslie, will you tell me a little bit about Breast Cancer Awareness Month?
Yes, it is an annual campaign to bring awareness, of course, to breast cancer. You'll see a lot this time of year, like breast cancer walks and fundraisers. And this is to promote or celebrate strength, hope, and support of those affected by breast cancer, not only the patients, but their families and friends also.
That's great. So can you tell me what percentage of women are affected by breast cancer?
So women and men both can have breast cancer. Usually about 1 in 8 women will have breast cancer and 1 in 100 men will have breast cancer. The American Cancer Society estimates that almost 300,000 women will be affected by breast cancer just this year. However, there are currently 4 million breast cancer survivors in the United States, so it does have a high survival rate.
That's great.
Yes.
That's great. So that was going to kind of be my next question is, can men get breast cancer?
Yes, absolutely.
Yes, they could.
Any cell in the body can become cancerous, and women, men also have breasts, so their cells can also be cancerous as well. But it is a lower incidence, only 1 in 100 men can usually get breast cancer.
So a lot of people ask, they've had, say their mom or grandmother or siblings even have had breast cancer.
Yes.
So is it hereditary?
It can be, and there is genetic testing available for that. If you have a known family history of breast cancer, you can be tested for the BRCA1 and 2 gene. And if you do have those genes, there is options out there available for prophylaxis, like mastectomies. You can choose to have mastectomies. But if you do have those genes, it is important to let your primary care doctor, your GYN specialist know that, so that you can start early mammograms, usually around age 35. And it is definitely very important for early detection and treatment.
Yes, definitely.
Yes.
I feel like we've come a long way
with
breast cancer research and better treatments,
Absolutely.
better preventative measures.
Yes.
So that goes into our next question is what steps can you take to prevent breast cancer development?
Okay, so one step to prevent breast cancer development is self-breast exams. This is done monthly at home. By men or women, and usually you'll do it while you're in the shower, after you get out of the shower. There are 5 steps, and if you find anything abnormal, you would of course report that to your primary care doctor, and they will then usually order a mammogram or ultrasound of the abnormal findings. But the first step is you'll examine your breast in the mirror with your hands on your hips. You want to look for any changes in the tissue, dimpling or puckering of your skin, orange peel appearance, nipple changes, any discharge from your nipples, or any protruding lumps or nodules. Then you will raise your arms above your head and examine your breast that way. You have to look at them in several views. Different positions can make things more noticeable. And then you'll look for signs of breast fluid and discharge. You can press on your breast to see if anything comes out. That would be an abnormal finding. And then you're going to feel for your breast lumps while lying down and while standing. So you'll use light, medium, and firm pressure. And you'll use the first three fingers on your hands. You'll use the pads of your fingers to examine your breast. You will use a circular motion or up and down motion with each type of pressure, and that's when you'll feel for any abnormal lumps or nodules. Especially if you'll also pay attention if the lumps are tender, or if they move around, are they soft, are they firm? And of course, anything that you find abnormal would need to be reported to your healthcare provider.
Definitely.
And then if you do find anything abnormal, or if you are 40 and older, you will be ordered a mammogram by your healthcare provider. And this is just simply an x-ray of the breast. There are two different types of mammograms, and that's screening and diagnostic. Screening is your basic mammogram, and diagnostic takes a deeper look if you have abnormalities or history of breast cancer. Usually, you have those annual, ages 40 to 49, and then after 50 and after, you'll have them every couple of years. And then depending on your age, your doctor may eventually just stop doing them, as the survival rate, of course, decreases as you get older.
Right, that makes sense. So how else can we support breast cancer awareness locally?
Okay. You can donate to nonprofit organizations such as the Susan G. Komen Foundation. We have the Wig Bank here in Caldwell County. You can wear pink clothing or a pink ribbon, but the most important thing is to spread the importance to your loved ones, your friends, your community about early detection and screening during this time and always.
Yes. The Wig Bank is an amazing organization here in Caldwell County.
Yes.
You can always contact them to see what their needs are. I just spoke with them not too long ago, and one thing they always need is individual snacks. We talked about people having treatment at the cancer center and just having to sit there for hours at a time for treatment, and they just make those little snacks available.
Yes.
And just having that little thing, you think it wouldn't be a lot, but just having them there to have something extra.
Yes, it means a lot to those who are going through that.
So anybody, that wants to donate anything to the Wig Bank, they can always contact them or look them up online.
Absolutely.
But that's also a great way to support local. So as far as the health department goes, can you tell me what we offer as far as breast health goes?
Yes, we have the BSEP program. The BSEP program stands for Breast and Cervical Cancer Prevention Program. It is for men or women age 40 and older who are underinsured or uninsured. However, men only participate in this program if they have a breast problem. However, if you are a woman who is underinsured or uninsured and less than 40 and find an abnormal breast lump or discharge, changes of your breast tissue, or have a cancerous pap smear, you can also be a part of this program. It is based on your proof of income, so when you come for your appointment, you will bring your ID and your proof of income. Based on your proof of income, you will only pay a percentage of your services for your visits, which could potentially be 0%. During this program, it's an annual visit that you come for, and you get a breast exam and pap smear. Pap smears are usually only every 3 years if they're normal, or if you have a history of abnormal, they may be more often. Breast exams will be done yearly, and of course mammograms will be ordered yearly. We do help facilitate scheduling of the mammograms through the UNC Caldwell Hospital, and we use Laurel Park for imaging. So they get them scheduled through the hospital. We set up your appointment. You go to Laurel Park, either in Lenoir or Granite Falls. They do your imaging there. And then we also help facilitate your results, calling you with abnormal results. If you do have abnormals, we help facilitate the next steps, any referrals you might need. If you would like to make an appointment, you can call 828-426-8400 to get that set up. And And if you do have abnormal mammogram and are pap smear and are diagnosed with cancer, we have something called BSEP Medicaid that we can help facilitate an application for, and that assists with your treatment, any procedures and doctor's visits that you might need. So that's the financial resource in the BSEP program, is BSEP Medicaid.
That's great that we have
Yes.
that for people who may not have insurance or, like you said, are underinsured. Well, thank you for being here
Yes.
today, Leslie.
Thank
I
you for having me.
appreciate it. Yes, and lots of great information. Make sure that you're doing your monthly breast exams. Make sure you're getting your
Absolutely.
yearly mammograms. And if you have any questions, please feel free to call us at the health department.
Yes.
And we'll see you soon.
Thank you.
So women at average risk with start mammograms at 50 have the mammogram every 2 years until they're 75 years old. If you're at high risk, such as having a abnormal BRCA1 or abnormal BRCA2 gene in your family, you would work with your provider to determine what screening recommendation is right for you.
There are several signs and symptoms of breast cancer, and one of the ones that folks know the most about, of course, is the lump, but there are others, like any unusual rash on your breast that may be dimply. It could be flaky, the skin could be flaky. Any discharge in the breast, blood or fluid other than breast milk. The inversion of nipples, any unusual swelling in any area of the breast. So I really want to encourage young women to know what your breasts normally look and feel like, so that when there is a change that's unusual, you can follow up with your doctor as soon as possible.